Our next speaker is Christina Petris, who's Managing Director of EIT Health for UK and Ireland. And we're really pleased to already have a collaboration with EIT Health. They're actually a sponsor of our quarterly Digital Academy Forum. So Christina, we very much appreciate that sponsorship, and we're delighted to see kind of the uptick of activity in Ireland associated with the EIT Health. For a while it was kind of overshadowed by the UK's sort of presence, but really pleased that you're based in Ireland and are already taking steps to increase the profile and the impact of EIT Health. So over to you. We're looking forward to your talk, Christina.
So just want to share my slides because the button's not quite coming up for me. Ross, can I trouble you to share because that button's not coming up for me to allow me to share?
Let me just check again because I just gave you permissions there a few minutes ago. And if not, I can drive them from this side.
Thanks a million.
Okay, any luck now?
Still not. Doesn't like me.
Okay, perfect.
Yeah,
well,
if you don't mind. Yeah, it's still grayed out, so it's not allowing
perfect.
me to do it.
I'll show them here. So. Now, bear with me for a second.
Sure.
While they load up here. The moment of truth.
It's my first time using WebEx. I have GoToMeeting, I have Zoom, I have Teams. There was another one there the other day, and now WebEx. It's a learning curve.
Okay, let me know if you can see them here. You should be able to see them now.
Yep, brilliant. Martin,
Great,
thanks for the lovely introduction. I'm actually delighted to tell everybody we're EIT Health Ireland UK. We transferred the entity to Ireland on the 1st of January this year, and this is where we're going to be based. We will still cover Ireland and the UK, but I think what we'll probably do is focus on Ireland, at least for the short term, and let things settle in the UK as they go through Brexit and still have some things to resolve in terms of associating with Horizon Europe. So we're currently working that through with our UK partners. But if I just move on to our presentation, and if I say next slide, thanks Ross. So EIT Health is actually the largest healthcare innovation partnership network in Europe, and it's funded by the European Union. Its mission is to become the leading platform, and mainly around how it supports across Europe in terms of facilitating and supporting healthier lives and more sustainable health systems. And that includes the promotion of better health for citizens and also building a sustainable health economy. I'm not going to go through the challenges because I have a feeling this group are really well aware of them. And if I move on to the next slide. So in terms of, well, how does it do that? So it does that through a number of different mechanisms. One of the first things it does is it looks to actually build connections between innovation, academia, industry, the network and its partners. And that's what probably I describe as the overall EIT Health experience. And having that, I suppose, diverse consortium from industry, healthcare providers, payers, research organizations, universities, and having a pan-European presence that includes 6 regional hubs, along with kind of what I'd call our regional innovation hubs, which look to cover Central, Southern, and Eastern Europe, also including Israel and stemming into the US. And through that, it looks to provide best-in-class programs, build international consortiums, and actually give access to expert mentorship and coaching networks, be it in industry, be it clinical, be it in health systems. So if I move on to the next slide. So what I thought might be helpful is to say, well, how does this apply to Ireland? And, you know, what does a European organization, how does it plan to work in Ireland? And we've identified 3 core priorities. And the first is to support driving health system transformation in Ireland, and that's by contributing to the economy and job creation. So if we provide opportunities to that best-in-class education and accelerator innovation programs, to support local innovators build strategic partnerships across Europe. We facilitate those network connections, and our teams can do that. If I just hop back one, Ross, my apologies. And help Irish partners build their profile across that European consortium. And the third one, which I think is particularly important, is again, I'm biased, but we punch above our weight in Ireland. So influencing and future-proofing against European policy, taking the opportunity to actually create, kind of use Irish test cases and create an environment in terms of how we can identify and remove barriers for adoption for European policy, and work with innovators in Ireland to actually identify the most pressing topics. So if we move on to the next one. We have two key areas of focus. The first one is around research commercialization, and that's supporting the development and launch of new products and services. And what's really important here is the commercially viable products and services for sustainable healthcare. And our programs help, kind of support right from that ideation and incubation stage into what it's like to go through a product validation, launching into market, and then what first and second round investment looks like. The second core area of focus is what we call the digital health revolution, and lots of people have spoken about it this afternoon. And that's how we support the enabling of digital health system changes. And we do that through education, innovation, advocacy. So we're a big fan of your shift left policy. If we move on to the next slide, just in terms of impact. So over the last year, just to give an idea of scale, in terms of from an entrepreneur perspective, we've supported 350 startups with about 170 million investments, working with VCs and then on their behalf to become pitch deck ready. Our innovations have touched about 18,000 patients, over 90 projects with 8 new innovative products on the market. We've supported the training of 26,000 citizens, 6,000 graduates, over 53 programs. And our thought leadership program, which is called Think Tank, looks to engage policy makers and decision makers around how we influence and also propose legislative changes through the European Commission roundtables, also through the Patient Forum, and through our own communication channels with our innovation summits and our spotlight series. So if I move to the next, this one for us is really around how we work with our Irish partners to actually help them build connections within our large network. And that was my purpose for putting this one up. So I'm going to move swiftly. And I wanted to give a couple of examples of how this works. So one example that I thought might be good to give is a high value care example. So this was a 2-year project that was funded by EIT Health, and it was with Uppsala Academic Hospital in Sweden. So it's 8,300 employees, 360,000 outpatient visits. And what they did was they said, we have lots of data, but we know we're not efficient and effective with it. And we have the data, but we have the people, but we need to link it with 2 things. And they identified that they needed to link it with the digital skills, and they also needed to link it with process. And in doing that, they focused on 43 care pathways that really kind of spread over 3 areas. One was around ambulance unit efficiency, the other one was maternity ward efficiency, and the other one was surgical resource efficiency. And what they did, just to very quickly, by way of example, is they made small changes, and they had senior support to actually, in terms of senior support and governance supporting the project. With ambulance unit efficiency, aside from going through the data to look through and inform them in terms of key areas to focus on, one of the changes that they made was they replaced operators with nurses. And in doing that, what they did was they reduced 17% unnecessary dispatches, and it didn't have any impact on patient outcomes. And they monitored, to make sure of this, they monitored about 1,000 patients afterwards where no ambulances were dispatched. So having a clinical person on the phone made a big difference to the number of ambulances dispatched. and made sure that there was resource available for those who need it most. With maternity wards, one of the things they did in terms, again, looking at data and process, was they looked at a specific area and said, well, how do we focus on our non-complex cases? And by doing that, what they did was they introduced what they called a new early discharge pathway that included midwife home care visits. And by doing that, they had a number of different outcomes on that. They saved 850 bed days a year. They also reduced induced births from 23% to 17%, which is below the national average. And they benchmarked their outcomes against another 8 obstetric departments across Sweden to understand the changes that they were making and whether they were making a difference or not. So that's a really good example of what's similar to what you've all been talking about this afternoon in terms of how actually looking at a high value care project, an integrated care pathway utilizing data, processes and digital tools can really make a difference to how we manage healthcare. If I go to the next slide, I just have 3 examples to share with you. Another core part of that is around education. That's the transformative digital skills for healthcare, in terms of what this looks like. So in doing this, what this program particularly looks at, and it's a program that has a combination of a professional academy, University of Barcelona, and also the Oxford Academic Health Science Centre. Created a development program, and what they wanted to do was that they wanted to develop a program that gives an understanding of digital skills technologies, and also one that looks to show how to transform processes, structures and cultures, and to measure the value and benefit of the technology in patient care. So that link between the patient care pathway with the process and the technology and the change management skills. They identified that 7 out of 10 workplaces have a total shortage of skill sets changes that they'll need to work on. The program's over about 3 modules. In 2020 alone, it's educated 120 health professionals, and it's, I think, closing soon for 2021. It'll be a program that EIT Health continues to support. It's online and it's flexible. So the third example I'm going to give you is around our think tank program on our next slide. So what think tank is, it's basically, it's an EIT thought leadership forum, and what it looks to do is it brings together healthcare leaders to actually look at the changes and innovation and identify the next opportunity for step changes. It has 2 examples. In 2019, it focused on optimizing the innovation pathway. And in 2020, it focused on transforming health with artificial intelligence. So if I give you the 2019 example in terms of for each innovation type, whether it's a device, it's a medicine or a software, it looked to understand what the key steps are in the innovation pathway and how to manage the change. So this is a good example. So we're currently doing 2 things at the moment. And one of the things we're doing is we're partnering with Quorum, who's the SFI Research Centre, looking at medical devices based in Galway, in terms of working with them through our think tank and how we can actually support reducing the barriers to research and enabling innovation. The second thing that we're doing, again, under our innovation pathway, and I like using good Irish examples, we're not long here in terms of doing that, is we're partnering with Blumetrics, and they're a company, they're an Irish company that help customers take the data they own and automate it in a productive form without actually ever touching the data, which helps from an ethical perspective in healthcare. And we're working with them to actually develop a user case-based example as the European Commission start to consider legislation for in what they call the European health data space. So there are a couple of examples of how we use our influence in looking to support research and innovation, not just in Ireland, but also to actually support it across geographies as well. So if we go to the next slide, that's it from me. And I wanted to give you kind of a whistle stop, knowing that, as Martin said, we haven't focused on Ireland before. This is probably going to be, you know, kind of the first time. We have partnerships, traditional, historical partnerships with NUIG and with Trinity, and the moving into Ireland will be to actually focus on supporting the very fertile and rich ecosystem that's here. And we're very happy to do that and welcome the opportunities it brings to support Irish healthcare research and innovation and education training.
Great, Christina, and thanks for a really great talk. And it's brilliant to have to hear EIT Health Ireland and the UK, and in that order. Already our living lab in Letterkenny under the stewardship of Michael Broderick. I know we're working with a consortium to apply for the high value care strand. So we're eagerly awaiting, you know, how that process will develop. It'd be great if we can land it